So this is category 3. So first we're going to do the psoas correction. So I'm going to make sure the patient doesn't have any launches or any belts on or anything like that. So just go ahead and raise your arms up. So we're going to come back and pull, hands together, check. So let's say that she had a left short hand. So I'm going to come over to the right side. You can both relax. Bend this knee for me. And I'm going to, with my superior hand, come up into where the psoas is. And as she's going to breathe in and breathe out, and as she breathes out, I'm going to be bringing her leg from lateral to medial. So take a deep breath in for me, and all the way out.
And then as they exhale, you're going to
and then breathe in for me, and all the way out.
and then hold that position,
And breathe in for me,
and exhale.
and all the way out.
And you do this 3 times.
So you do that 3 times, and then you straighten that leg out, and then we're going to come back and check. So let me see your arms again. And her arms should be even. Awesome. Go ahead and flip over for me. Next, we're going to do the prone leg length. So the patient will be face down. Just come out and bring the legs out, push against my hands, and relax. And check. So she has a right short leg. I'm checking the medial malleolus to see which one's more superior. So she has a right short for this one. The next part is the gluteal fiber analysis. So I'm going to come in and I'm going to find her iliac crest, and on each side I'm going to go different points. So we're going to go, let me know which one of these is the most tender. 5, 4, 3, 2, 1. 2. Okay, come in on the other side. And 5,
Oh,
4, 3,
my shoulder's at the end. That's okay.
1.
It's okay, because I'll just 2.
2. Which one on the right or the left?
Oh, you just say that.
The left. Okay. So then I'm going to come in and find L2, and then just palpate to see if the spinous is tender and if the mammillary is tender on my side. And then I'm going to correlate that with the cervicals through the love-brother relationship and see if the cervical spinous matches the lumbar mammillary, or if the cervical TVP matches the lumbar spinous. So the next part is the indicators. So I'm going to be on the side that is the sciatic side, and I'm going to come in and I'm going to just kind of push around in the calf and see, and the patient will let me know if anything is tender in there. Then I'm going to come up to the hamstrings and do the same thing and just kind of look, ask her if there's any pain anywhere, and then come up to the glute area also, make sure to see if there's any pain anywhere. And then the last location is I'm going to come up to the TS line and see if there's any pain or any tenderness in that area. If there was any of these, then once we were to block them, we'd come back to check to see if the indicators went away or if they were still there. The next part is the SOTO. So this is done on the sciatic leg as well. So I'm going to come over and I'm going to go underneath the knee and underneath, and above the knee and at the ankle, and I'm going to bring the leg out until I see the glute bunch, and then I'm going to rotate out about 15 and hold for about 15 seconds, and then when I'm done for 15, I'm going to bring the leg back in and just wait, and we're going to wait 2 minutes, and then we're going to come back in, do the same thing, bring the leg out, and then rotate, hold for 15 seconds, and then we're going to bring it back in. After that, we're going to ask the patient what she felt between the first one and the second one. If she says that the pain got better, it's a piriformis problem. If she says the pain got worse, it could be a sequestered or fragmented disc. And if she says it stayed the same, then it could be a disc herniation or a lumbar subluxation. And if the pain was getting better, then I'd continue to do this until it was completely gone, or until she was saying that nothing was changing again.
I know what it's called.
So this is category 3 blocking. So we're going to come in and we're going to check to see which is her short leg. So go ahead and push your legs against my hands. Relax. Good. And so she has a right short. So we're going to bring this knee up. Do you have any knee problems? Okay, so we're going to rotate, and then the first block is going to go inferior right at the trochanter. And then on the other side, do you have any knee pain on this or any knee problems on this side? And then we're going to go inferior at the ASIS. So when you're blocking for this, you're gonna block up to, you're gonna block for a maximum of 30 minutes. If for some reason the patient is still having some pain within the first 30 seconds of you doing this, you're gonna start on the short leg side and you're gonna change the angles at 5 degrees until you get all the way superior to it. If that still doesn't reduce the pain, you're gonna put this block in where it was started, and you're gonna come to the long leg side and angle that block the same until there's no more pain, until the patient's not feeling any more pain. So then next we have the posterior iliofemoral ligament. So you're gonna come down to their feet, and we're gonna just internally rotate each foot and see which one doesn't go in as far. So we'll say it was her right leg. So then I'm gonna come up to the trochanter and I'm gonna go up an inch and back an inch, and then with a double thumb contact, I'm just going to do a posterior superior toggle and then come back and recheck. And they should be the same, they should each rotate in 45 degrees at that point. Next we have the lumbar vertebral derotation. So for this, we're gonna beat, the indicator is cervical TVP tenderness. So we're gonna come in and find which side the TVP is tender. So we'll say it's on this right side, and we'll say it was C3. So then we're gonna come down and correlate it with the Lovett-Brother relationship in the lumbars. So it'll be L3 for in the lumbars. So come in, and I'm going to be on the spinous process on that side. So the spinous would have rotated to the right side for this. And then I'm going to have the patient go ahead and, if you can, reach the top of the table and grab a hold of there. Okay. And as she's going to bring her leg up, and as she tractions up, and on inhalation, I'm going to push the spinous lateral to medial. So go ahead and take a deep breath in. 2, 5, and relax. And breathe in. And relax. And breathe in. And relax. Okay, so you're going to do that 3 times. Then we have the lumbar inferiority lift. So the indicator for this one is cervical spinous tenderness. So I'm going to come in and check to see if there's a tenderness in her cervicals, and we're going to correlate that with the Lovett-Brother relationship as well in the lumbar. So if it was the C3 spinous, then we're going to go to the L3. We're going to go to the L3 TVP or mammillary on that side. And then we're gonna do the same thing, except this time we're gonna go I to S on that mammillary or TVP. So as she breathes in, I'm gonna traction, or I'm gonna push I to S for 5 seconds, and then breathe out, and then breathe in for 5 seconds, and breathe out. And we're going to do that 3 times as well. So then next we have the acetabular goading. So we're going to come in, and the indicator for this is sciatic pain or acetabular pain. And so if it was on her right side, we're going to come into that spot, and then with the leg, we're going to internally, we're going to externally rotate that hip, and then just goad on the acetabulum. And then bring it out and do the same thing and just goad the acetabulum. If the blocks were in the way during this, I would remove the block and do this and then put the block back in. Next we have the orthopedic blocking. So this is an alternate for the lumbar rotation. So if the patient had knee pain and I wasn't able to do that, then I would just take out the block on the side of the lumbar spinous process rotation. So if it was on this right side and it was that L3, then I would just take this and I would just remove the block and just let the rotation come back, or let the spinous just rotate back to midline. The next one we have is static traction. So with this one, I'll bring this back in. The indicator for this is sciatic pain. So if it's on that right side, I'm just going to come in and I'm going to be at the ankle, just right above it, and I'm going to have you, Hannah, grab the top of the table again and breathe in for me. And as she breathes in, I'm gonna traction down. As she tractions up, I'm gonna hold this for 5 seconds and then relax. And then breathe in. And we do this for 5 seconds and then breathe out. And we're just gonna continue to do this until she says the pain is getting better or there's no more improvement. The last one is the alternate sciatic traction, and during this I would have my lovely assistant be tractioning on the foot, and then I'm gonna come in to that spinous process, and as they breathe in and they traction, I'm gonna be pushing I to S on that spinous for the 5 seconds and then relax. So for sacral cup, we're gonna go ahead and remove the blocks. And we're gonna come in and I'm gonna ask my patient to raise this leg for me, and I'm gonna stabilize this pelvis. So go ahead and raise this leg up. And then we're gonna do the other side. So raise this leg, and then, push, and then raise this one up again, and then push. Good. So whichever leg, if there was a weaker leg, then I'd come into the sacrum and I would go to the sacral cups. The upper cup is between S1 and S2. So go ahead and raise up for me and resist, good. And then go to the lower cup, which is between S3 and S4. Raise up and resist, good. If one of these made that cup stronger, then I'd be on that side and I'd come in with just a double thumb contact and just apply P to A pressure for 5 seconds, or I could do a toggle on that spot. And then I'd come back and I'd recheck to make sure that that side was strong again. After this, we have the sitting disc technique, so I'm going to have you go ahead and sit up for me and face this way. Face that way. I'm going to have you sit on this. There we go. So I'm going to have you put your hands on your legs for me and take your chin down. So for this part, I would know which level the disc lesion's at. So we'll say it's L4 for this one. And so as you take a deep breath in, I want you to tuck down even further and push your back against my thumb. So go ahead, take a deep breath in. And I'm gonna apply I to S pressure, and then exhale and come back up and lift your head up and lift your chin up, and I'm gonna apply P to A pressure as I exhale. And then breathe in, and then I to S, and then breathe out, and P to A. And I'm gonna do this about 3 to 5 times, and just continue to do this, and hopefully this will help release some of that pain. The last part is the side pressure. So you can go ahead and I'm gonna have you put this out, and I'm gonna have you put your left side down for me. So for the side posture, if it's a rotated, a rotated vertebra, the sciatic side is gonna be down. So we'll say her left side's her sciatic side, and then the rotation needs to be down. So that vertebra needs to be rotated down as well. So I'm gonna have you scoot closer towards me. So we're gonna bring this leg up, and for these I'd obviously be down on a lower table, and then come in, and for this I'm going to be on the mammillary process, and I'm going to do a P to A thrust for this one. Okay, so then for an inferior subluxation, the sciatic leg should be down and the inferior wedge should be up for this, and then you're going to be contacting on that mammillary, and the line of drive is going to be I to S.